Hey class, welcome to another week of medical terminology. I hope that by now you guys have been able to access all the material on Blackboard as well as FA Davis, and that you guys are finding some type of rhythm in order to stay on top of the weekly work. As usual, if you guys have questions or concerns, you guys can always email me or reach out to me through the Remind app. And I'm here to help you, okay? This week, of course, we're going to be going over chapter 6 of your book, which covers the digestive system. Last week, I started the lecture with a nice little dad joke, and so I figured what better way to start this week than another dad joke. So we'll give it a try. What do you call a stolen digestive medication? All right, you give up? I call it a klepto-bismol. That's actually a really good one because I did a combination of two words, which, we went over on, chapter 1, and made it a little funny, klepto-bismol. Anyway, I thought it was funny. All right, let's get to it, all right? One of the biggest things that I was taught was during anatomy and physiology was this concept of form follows function. As you can see in this awesome illustration, the form of the body part kind of follows the function that it's designed for it to do. So in other words, the form of that body part or that structure is directly related to its function. The form or shape of that structure within the organism correlates to the purpose of the function of that structure. You are going to see this play out very heavily in this chapter because the shape and the form of many of the organs that we will be talking about correlate directly with the purpose and the end result of that organ. All right. All right. So keeping the structure follows function in mind, let's go over some of the structures that we're going to be going over in this chapter. We're going to be going over the oral cavity, which includes the teeth and your saliva. We're going to be going over your pharynx. We're going to be going your esophagus, your stomach, your large intestine, and small intestine. Keep in mind that the digestive system is also referred to as a GI system or the GI tract. It'll consist of the digestive tube called the GI tract or alimentary canal and several accessory organs whose primary function is to break down food. It is also going to prepare the food to be absorbed by its body, and it's also going to prepare it to eliminate it out of our bodies as waste. The GI tract extending from the mouth all the way down to the anus varies in the size, it varies in the structure, and it varies because it's passes through several distinct regions of our bodies. So there will be some slides that I added to the slide deck that kind of breaks everything down, and it shows it a lot better than just explaining it. They say a picture is worth 1,000 words, so I think a video is worth even more, which is why I found this one video online that I found to be extremely helpful. Personally, I love watching cartoons. Some people would say that I never grew up. So anytime that I can find a complicated subject or a concept that can be explained with cartoons, I'm gonna go for it. And this next video, it does exactly that. It's gonna go through the entire system of digestion from mouth all the way to getting it out of the body.
Today we're going to learn about the digestive system and digestion. So that our body can make the most of the food we eat, it must first transform itself into a simple substance called nutrients. These nutrients are then transported by our blood around our body to be used and converted into energy. This food transformation process is called digestion and is done in the digestive system. The digestive system is a very long tube through which the food travels and is made up of the following parts. The mouth, this is where the digestive journey begins. The teeth both chop and grind up the food we eat. Once it has been made into a ball, it is pushed down the food pipe to the pharynx. The pharynx is a cavity which shares the digestive system with the respiratory system. It is from the pharynx that the food goes to the esophagus. The esophagus is a soft muscular tube that moves food further down to the stomach. The stomach is a widening of the digestive tube. It creates a movement which allows food with a mixture of gastric fluids. Once this process has been done, it then travels to the small intestine. The small intestine is called small because of its width, not its length. It is actually a lot longer than the large intestine, measuring up to 7 meters in length, almost as wide as a football goal from post to post. Well, it is here in the small intestine where the food digestion journey ends. Now it is up to fluid processes by 2 glands, the liver and the pancreas, to finalize the transformation from foods to nutrients. Once the food is converted into nutrients, they then traverse the small intestine's walls and filter into our blood, where they are then made good use of by all of our body cells. But what happens to the food that our body doesn't need? All that, such as fiber for example, is transferred into the large intestine. The large intestine is a thick tube which accumulates substances which our organism cannot digest, and it is where water from these substances is absorbed. The substances then form fecal matter, or what we call poop, and it comes out of the anus. It sounds a little bit disgusting, but that's how our body works. Anyway, friends, I hope you found the digestive system and digestion as interesting as I did. See you later, and don't forget to subscribe to Happy Learning.
Well, I hope that was very informative. You can see how it kind of broke everything down very informatively and very easy to follow. All right, this picture here is in your books. It is in one page in your book. Obviously, it doesn't fit on my slideshow as one page, so I decided to split it into 2 pages. But let's go together and kind of follow the path of food here, okay? So as food enters our mouth, it is chewed down by our teeth, okay? And it between the teeth grinding and the saliva in our mouth, it kind of makes it into a ball that, whether you know it or not, your tongue, as you're chewing, is making your food into like this ball of food, basically. As you swallow that food, it's going to be going down, down, down into your stomach. Once it enters your stomach is going to go through the process of churning it. And your stomach basically has all these different muscles that turn the food, and it churns it. And the concept of the stomach is to mix everything up along with the gastric juices that are in the stomach. It starts breaking down the food. Keep in mind, the stomach is not where your food is absorbed, okay? That is not happening in your stomach. So I just want you to be aware of that, so that if you ever encounter a question like, does the stomach absorb food? No, it just breaks it down, okay? And continuing forward from the stomach, it continues going. The liver, the gallbladder, and pancreas, those are accessory organs, and we'll address those in a later slide, but they bring in your bile and they bring in your enzymes, into what's called your duodenum. In your duodenum, from there it goes into the jejunum, the ileum, the cecum, following to the ascending colon, your transverse colon, which if you remember last week we talked about a transverse plane. So transverse being side to side, right? So this colon should be the easiest ones for you guys to identify because it will be the colon that is going from left to right. It'll be the only one, okay? From there, it's going to go down to the descending colon, so coming down. Ascending, going up, descending, coming down. From the descending colon to the sigmoid colon, to the rectum, to the anus, to your toilet, okay? Let's go over your mouth, okay? Your oral cavity is the first part of the digestive tract. It includes your mouth and teeth, where the mechanical process of chewing and the chemical breakdown of food by your saliva takes place, okay? Let's start with the teeth. The teeth play a very important role in the initial stages of digestion by mechanically breaking down food into smaller pieces as they mix around your mouth with the saliva. Teeth are covered by a hard enamel, giving them a smooth and sort of white appearance. Beneath that enamel is dentin, the main structure of the tooth. Okay, that's very important that you guys know that. That the dentin is the structure of the tooth. The innermost part of the tooth is the pulp, which contains nerves, it contains blood vessels. The teeth are embedded in pink fleshy tissue, also known as gums. If you open your mouth and you see above your teeth, you see some gums, okay? In addition to your teeth, you have your tongue, which, as we discussed, kind of help assist in the chewing process, okay? It does so by manipulating the bolus of food during the chewing and moving it to the back of the mouth for swallowing. The tongue also aids in speech production, and of course, we're not gonna forget, taste, all right? Rough projections on the surface of the tongue called papillae contain taste buds. The four basic taste sensations registered by chemical stimulation of the taste buds are sweet, sour, salty, and bitter, all right? All other taste perceptions are combinations of these four basic flavors, kind of like the color wheel, right? You got to take, now I'm not a painter, okay? So I think it's like blue and red make purple, but you get the point. You got your basic color elements and then you have your other elements. Same thing goes with our taste buds. We have these basic taste buds that everything else gets broken down from. In addition to the sense of taste, it is also intricately linked with the sense of smell, making taste perception very complicated, okay? So this is gonna sound very disgusting, but when somebody lets gas out and you quote unquote smell it, 9 times out of 10 you're more tasting it than you are smelling it. So think about that next time you're having dinner with Uncle Joe and he decides to let one rip, okay? Hard and soft palates, okay? The two structures forming the roof of the mouth are the hard palate, and in this picture I believe it's number 4, and the soft palate, which is on the posterior portion of the mouth, and I believe it's number 5 on that slide, on the picture. The entire oral cavity, like the rest of the GI tract, is lined with mucous membrane, okay? Make sure you guys keep that in mind. All right, the next part of the body that I would like to address is the pharynx, the esophagus, and the stomach, okay? As the tongue pushes the bolus into the pharynx of the throat, it is guided by the soft, fleshy V-shaped structure called the uvula. All right. The funnel-shaped pharynx, serves as a passageway to the respiratory and GI tracts and provides a resonating chamber for speech sound. The lowest portion of the pharynx divides into two tubes, one that leads to the lungs, which is called the trachea, and the other that leads to the stomach, which is called the esophagus. There is a small flap of cartilage that is called the epiglottis. It's number 10. Let me see. Pretty sure it's number 10. Probably in the previous slide. And anyways, this epiglottis folds the back to cover the trachea during swallowing, which is forcing food to enter the esophagus. At all other times, the epiglottis remains upright, allowing air to freely pass through the respiratory structures. Okay. The stomach, which is the biggest part, I'm going to try to highlight that. There we go. The stomach, right here, is a sac-like structure located on the left upper quadrant. All right, LUQ. Remember, we talked about that last week. You're going to start seeing these quadrants play into a major role as we're talking about all these structures now, okay? Anyway, going back, it's in the left upper quadrant of the abdominal cavity, and it serves as a food reservoir that contains mechanical and chemical digestion, okay? The stomach extends from the esophagus to the first part of the small intestine, the quote-unquote duodenum. The terminal portion of the esophagus, the lower esophageal sphincter, is composed of the muscle fibers that constricts once food has passed into the stomach. It prevents the stomach contents from regurgitating back into the esophagus. Okay? The body of the stomach, the large central portion, together with the fundus, which is number 5. I'll try to put it. Where are you, buddy? There we go. It's the fundus of the stomach. The upper portion are mainly storage areas, okay? Most digestion takes place in the funnel-shaped terminal portion, the pylorus, which is number 6, right there, okay? The interior lining of the stomach is composed of mucous membranes and contains numerous microscopic longitudinal folds called rugae that gradually unfold as the stomach fills. Located within the rugae, I don't know how you say it, so that's on me, but it's R-U-G-A-E, okay? I call it rugae. Anyway, it has digestive glands that produce hydrochloric acid and enzymes. Secretions from these glands, coupled with the mechanical churning of the stomach, turns the bolus into a semi-liquid form called chyme that slowly levels the stomach throughout the pyloric sphincter to enter the duodenum. This sphincter regulates the speed and movement of chyme into the small intestine and prohibits backflow. Food is propelled through the entire GI tract by coordinated, rhythmic muscle contraction called peristalsis. Okay? Come on, slide. There we go. All right. The small intestine is broken down into 3 parts. It is duodenum, which is the first segment, the jejunum, which is the second segment, and then you have your ileum, which is your third segment. Digestion is completed in the small intestine with the help of additional enzymes and secretions from the pancreas and the liver. Nutrients in the chyme are absorbed through microscopic finger-like projections called villi. Nutrients enter the bloodstream and then the lymphatic system for distribution throughout the rest of the body. At the terminal end of the small intestine, a sphincter muscle called the ileocecal valve allows undigested or unabsorbed material from the small intestine to pass into the large intestine, which will eventually be excreted from the body. Here we have a very awesome projection of our small intestine, large intestine. We have our stomach, and you can see the spleen kind of hovering back here, trying to hide from us. But on this one, let's go ahead and address the large intestine, okay? This large intestine is approximately 5 feet long, and it begins at the end of the ileum and extends all the way down to the anus. No digestion will be taking place in the large intestine. The large intestine has 3 main components, as we've discussed. It has the cecum, the colon, and the rectum. The first 2 or 3 inches of the large intestine is composed of the cecum. Let's go ahead and find that bad boy right there. Okay, a small pouch that hangs inferior to the ileocecal valve. Projecting downward from the cecum is the appendix, which is right here, which is a small worm-like structure with no apparent function that can become inflamed and infected when blocked, appendicitis. I do have a funny story on appendicitis. Nobody really knows what kind of causes appendicitis. There's different areas that people say, you know, this entrance right here sometimes gets clogged by some fecal material, and that's what causes it to get inflamed and therefore get infected and so on and so forth. But anyway, the funny story I wanted to talk about was about a year and a half ago, my wife and oldest son went down to Florida. They went without me. And they had different meals at the airport, but when they landed, my son started having some extreme pain. Long story short, he ended up having appendicitis and they had to remove his appendix. While they were in the midst of surgery, my wife begins getting this extreme pain, almost identical to our son's pain, and she ends up having to have her appendix removed pretty much within 12 hours of my son's appendix. I said, we definitely need to write the Guinness Book of World Records, because there's no way anybody has probably had to go through this way. But it was very interesting fact. The doctors that did the surgery on my wife said that they have never seen a mother and son have appendicitis within 10 hours of one another. So that was very interesting. That surgery that they had, it's called an appendectomy. But anyway, the cecum merges as it becomes the first part of the colon. The main function of the colon are to absorb water and minerals and eliminate undigested material. The colon is divided into the ascending, which is right here, and then the transverse, which is right here, which, like we discussed earlier, is transverse, side to side, okay? And then we have the descending colon, which would be right there, right back here. The ascending colon extends from the cecum to the lower border of the liver and then turns abruptly to form the hepatic flexure. The hepatic flexure would be right there. The colon then continues across the abdomen to the left side as a transverse colon, curving beneath the lower end of the spleen to form the splenic flexure, right there. As a transverse colon turns outward, it becomes the descending colon. The descending colon continues until it forms the sigmoid colon and then the rectum. The rectum is the last part of the GI tract, and it terminates at the anus, where then whatever you ate is going down the toilet. Okay? And then just like last week, we were going over combining forms and combining words. We're going to go ahead and continue that same concept this week. As I addressed in previous lectures, the slide deck that is published on Blackboard does not have the answers. It'll have a blank slide, and then the next slide will have your answer key, so that you will be able to kind of practice and go through it as you wish, okay? Here we can see the combining forms of the word. So you got your esophagus, being the combining form. You got your pharynx, you got your stomach, you got your pancreas. Same thing here, continuing forward, same exercises. Same. All right, here we're going to be able to complete the medical word, okay? So discharge or flow throughout, we're going to call that diarrhea, all right? When you don't have an appetite, that would be anorexia. And when you're having difficulty or painful swallowing, that's going to be dysphagia. After a meal, we're going to call that post or prandial. So post lobster. That would be awesome. Pertaining to under or below the tongue, sublingual. You'll see a lot of medications are given sublingually because they dissolve under the tongue. The visual examination within or inside of an organ is called endoscopy. All right, when you are vomiting blood, that's hematemesis. A tumor of the pancreas is called a pancreatoma. And an instrument for examining the stomach is called the gastroscope. All right, enlargement of the liver is hepatomegaly. A disease of the intestine, usually in the small intestine, is called enteropathy. And then the inflammation of the gums is known as gingivitis. All right, let's go over some diseases and some conditions, okay? We got appendicitis, which is an inflammation of the appendix. It usually results from obstruction or infection caused by fecalith or foreign body or bacteria. Again, like we discussed, there is no known reason why it becomes obstructed. It just kind of happens. Different providers will have different opinions on that, so I'm not gonna go down that rabbit hole. But some signs and symptoms for appendicitis, all right? You have some pain, usually becoming localized to the right lower quadrant. Sudden spontaneous relief of pain indicates a ruptured appendix, which kind of is bad juju, all right? So the sharp pain, as long as you're having the pain, then it's just inflamed, it's infected, but it's still, if you could imagine just having a balloon right there, and it's that balloon, as it's expanding, it's creating more pain. There's only so much that it can expand before it pops. And when that balloon pops, the inside of that balloon, aka your appendix, has an infection going on in there, which caused the balloon to swell up. So when it exploded or it popped, all that infectious material is now free game for your entire abdomen. So where before, when it was contained within the appendix, it would have been a cleaner surgery and much less riskier surgery. When the appendix is bursted, now we have to deal with a, catastrophic effect that that is brought forth because now we have all this infectious material just everywhere. It's no longer contained in a nice balloon, okay? For fever, malaise, diarrhea, or constipation, are later signs and symptoms of appendicitis. The treatment, well, the treatment is pretty simple: appendectomy. It's a surgery within 48 hours of the first symptoms. Avoiding delay of the surgery can result in the rupture, and as we said, a rupture kind of makes everything that much more difficult. As I discussed earlier on the story between my son and my wife, where my son had the appendicitis, his actually ruptured. So where my wife's surgery took, in and out, she had her surgery, she was in recovery that day, and she was released from the hospital within, I think, 24, 48 hours. My son was held in the hospital for about a week. Fast forward, after that week, we brought him back home, and we noticed he just wasn't recovering as well as we were expecting. It wasn't eating, he was still losing weight, he was looking jaundiced. So we called his medical provider. We went to UT here in Jacksonville, and next thing you know, he's getting medevaced all the way down to the Children's Hospital in Dallas because he had gone sepsis, because he had a massive infection that was a direct result of his appendix rupturing when he had the appendicitis. So this is very important that when you do feel that you're having any signs and symptoms of appendicitis, that you get it treated as soon as possible, and you don't wait for it to get better, because when it feels like it's getting better, it's actually getting worse. All right, here's a practical exercise. Mr. Q presents to, I believe they meant ER, but okay. Presents to the ER with right lower quadrant pain, a right abdomen with increased tenderness, and abdominal cramping. The physician confirms inflammation of the appendix. His diagnosis is appendicitis. We talked about this. All right. Next disease we could talk about is diverticulitis. All right. This is an acute inflammation of the diverticulae. Diverticulitis is the presence of diverticulae without inflammation. All right, some signs and symptoms. It varies in intensity and duration from case to case. Bowel changes, possibly alternating between constipation and diarrhea, are obvious signs. Tenderness and pain to the left lower quadrant of the abdomen. Possible bleeding as condition worsens, along with weakness, fever, fatigue, and anemia. Possible rupture is also a possibility with this. Some treatments, okay, focuses on clearing up inflammation and infection, resting the colon, and preventing or minimizing complications. Hospital stay required for severe cases with acute pain and complication. Definitely antibiotics will be beneficial here, and a few days without food or drinks are put in place in order to help the colon kind of take a rest. Colon resection required for some cases with a temporary colonoscopy while the colon heals. Miss O's radiograph shows a pouch-like herniations throughout the muscular layer of her colon. These small blistering-like pockets are diagnosed as, we just went through this, okay? Another disease we can go ahead and address is cholelithiasis, which is a formation or presence of gallstones within the gallbladder or bile ducts. Cholelithiasis, some signs and symptoms. Patients with gallstones possibly are asymptomatic. Classic attack from the bile duct obstruction called biliary colic can be seen. Acute onset of upper right quadrant abdominal pain that radiates to the shoulder and back. Some possible nausea, possible vomiting. It typically follows ingestion of a large meal. So this condition has non-surgical treatments available, especially if the patient is asymptomatic. That's being unless the symptoms reappear or if there's a history of previous gallstones with complications. There's different therapies. There's acid-based therapies. There's shockwave therapy that don't require surgical intervention. However, for more severe cases, there is a surgical treatment. It's called laparoscopic cholecystectomy, cholecystectomy. Good luck with that one, which is a minimally invasive procedure. It's the most common procedure performed, and the laparoscope is inserted through several small incisions in the abdomen, with the patient usually being discharged within 24 hours or less. Some additional procedures that we can talk about is the bariatric surgery. This procedure has gained a lot of traction lately, especially, I believe there's a show called like My 600-Pound Life or something to that effect, that follows the lives of these patients that are morbidly obese. And anyway, it's very interesting to see how drastic the change in a patient's weight is after the surgery. This surgery basically takes a stomach and it alters its shape by removing a portion of the stomach. There's different surgeries. There's the lap band surgery. There is the bypass surgery. There's about like 3 or 4 options, I believe, that you can do. And basically the goal to this surgery is to make the stomach smaller so that patient can feel fuller on a smaller amount of food, and therefore causing a rapid weight loss. Another procedure that we can speak about is colostomy. In this procedure, basically, there is a certain part of the patient's colon that is diseased and is causing some type of issues, and therefore that portion of the colon is removed from the body. This could be permanent, it could be temporary. The procedure, I mean, the colostomy, it could be permanent, it could be temporary. And basically, it is performed as a treatment for diverticulitis and for certain types of cancer, specifically colon cancer. In this procedure, basically, there is an opening that is done to the abdominal wall, and the flow of fecal material is diverted from the affected area outside of the body into a bag. The next procedure we can talk about is the polypectomy. This procedure is where we removed a small tumor-like growth called the polyps that is projected from a mucous membrane surface. Basically, we just removed that polyp off of the body. And anyway, that's that surgery. You have also endoscopy, which is a visual examination of the interior of organs and cavities with a specialized light instrument called an endoscope. Endoscopes are named for the organ, cavity, or canal being examined. Okay. The colonoscopy. This is an examination of the entire length of the colon. It is an exam that is used to look for changes such as swollen or irritated tissues, and a lot of times it's also used to identify cancerous polyps throughout the colon. Another group of procedures that we can discuss are the barium enema. Those of you that will be entering the radiology program here at Kilgore College will probably have a chance to see this procedure take place. During this procedure, barium sulfate is administered through the rectum of the patient, and then that patient is x-rayed. During the x-ray, we're able to identify issues within the rectum and the colon. Another procedure is called the barium swallow. On this procedure, the patient drinks a liquid of barium sulfate. while the patient is drinking this fluid, the provider would x-ray the esophagus, the stomach, or the small intestine, and you're able to identify any issues because barium sulfate is radiopaque, which means it will be a very stark contrast to the structure if it didn't have the barium sulfate. Another procedure is ultrasonography or ultrasound. This is a high frequency sound waves directed at soft tissues to produce an image on a monitor or internal body structures of the internal body structures. Since we're in the topic of the colon and the rectum, then there are some procedures that are in place to help us diagnose issues within the stool samples of a patient. So for example, the stool Guyot test is a lab test that detects the presence of hidden blood within the feces. You also have the stool culture test, which is a lab test which identifies microorganisms and parasites that may be present in the feces of a patient, which can be causing gastrointestinal infestation. And this is a great tool to help providers treat and diagnose certain infections and certain diseases. Going into some additional exercises, here we have the building medical word exercises. The visual examination of the sigmoid colon is called the sigmoidoscopy. We also have the instrument for examining within a body cavity. It's called the endoscope. And then we also have the instrument or the visual examination of the stomach, which is the gastroscopy.